Primitive reflexes. Dr. Skip, Dr. Laura, I'm a mom, I'm a dad, I'm listening for the first time. Why do I care? What's primitive reflexes?
I'll start it off and just try to keep things relatively simple, because you can get all sorts of complicated with this. Basically, when you're in utero, so we're talking about, mom's pregnant, and what may or may not be realized is that when a baby is in utero, their brain's developing at 1,000,000 miles an hour, and they have a role in their birth. Clearly, it's not a conscious role, if you're talking about pre-birth, but it's a reflexive role. They have, the mother pushes when the baby's getting ready to be born. The mother pushes and has a role in the birthing process, of course, but the baby also has a role. And the baby's role is pretty significant in terms of getting itself born. I mean, that's how I'll say it to parents is there's a fancy somersault that a baby has to do to kind of turn around in the womb and have their head facing out. And they have to do, so it's a reflex. It happens automatically. A baby's primed for that, genetically, and just being a baby, that's what all babies have, is this instinct. And so you have prenatal instincts to get yourself born, do this somersault. And the other thing I'll say is while you're in utero, so many things are developing. In the way I say it to parents is this is where your GPS system develops. It's where you learn, or you get a sense for north, south, east, west, up, down, left, right. Kind of they call it the proprioception. The distance between your joints and gravity, your joints and the ground, and your joints and north. So I'm talking about your literal joints, like your elbows and your shoulders, and so your body gets primed for knowing where they are in space, essentially. So you have these prenatal reflexes that get you born, or help yourself out, and then you have postnatal reflexes as well. So every baby eventually crawls, and that's a reflex. You reflex for your legs to move in a certain way. Even before you crawl, you have reflexes to have your hands on the floor and push your butt up and sit up, this kind of stuff. So, well, there's standing, and that's probably the standing reflex, but yeah, there's a sitting reflex, a rollover reflex that prevents you from suffocating, on a bed or mattress, whatever. So you have this rollover and the crawl and the scooch and the getting ready to stand, and all of these things are reflexes that all babies are wired with. And so we call those primitive reflexes because they just happen, and they're going to happen automatically, most healthy babies.